Welcome. Rouge LilyTV. Massage Therapy Exam Prep. Room 3, Assessment 1, Speech Station. Guys, this is a script that may be helpful in your oral or practical examination either in school or in your certification examination. You may use this script, but you can always make your own for your examination. This is just to give you an idea. Important tips for the practical or moral examination. First, you will be stationed outside the door for each room. You will be given 2 minutes for each scenario or the list of tests for the assessment examination. During the 2 minutes time, you should already getting ready of your script and make sure to categorize each test accordingly, like for example, all the tests you are going to perform while the client is in standing position, sitting position, and lying down on the table position. In this way, you will not be rushing up and you will be able to do all the tests smoothly within the 10 minutes allotted time while you are inside the room performing all the tests. Take note guys, make use of the 2 minutes given to read the scenario while you are still outside the door to prepare your script and try to remember how to perform each test given in the scenario. Upon getting inside the room, smile, look at everybody and greet them by saying, "Hello everyone, good morning or afternoon." This greeting will be addressed to all, your client and the CMTO examiners. Then, proceed to the examiners right away, with a sweet smile to get your name scanned. Then, proceed to the sanitizer to sanitize your hands and elbows before you start facing your client. Say, "I'm gonna blank, wash or sanitize my hands and elbows for 10 seconds. Upon facing your client, smile and greet your client by saying, "Hello there, or good morning or afternoon, my name is blank, state your name, your therapist for today. How are you?" Wait for client to answer. Then ask this question right away. "Are you comfortable in your position right now?" Then wait for client to answer. Ask this question right away to the client for client care. We are now finished with our case history interview, so right now, I will be performing some assessments on you to have a better understanding of your presenting condition and come up with a clinical impression in order to devise an effective treatment plan. I will be performing some special tests, range of motion, neurological tests, and palpation of some anatomical structures. I will be looking for a positive or negative result in all the tests. During the assessments, I may be touching you or move you in certain positions. Is that okay with you? If you feel any pain or discomfort at any time, please let me know and I will stop immediately. Do you understand everything? Do you have any questions before I begin? Guys, for the Assessment 1, Speech Station Examination, you will need to perform the following tests. It is important to study all of these tests for the assessment examination. Special tests in random order during the examination. Orthopedic tests. Study most of the special tests as you will have no idea which special tests will be included during the test. Deep tendon reflex. Study most of the tendon areas for this test. Myotome. Study all. Dermatome. Study all. Tinel sign. Study all. Range of motion. AROM/PROM/RROM. Study all. Palpation of anatomical structures. Study most of the anatomical structures for palpation test. Pulse assessment. Study most of the main pulse areas for the test. Note, you can do either of these tests in random order during the actual practical examination. There are 3 types of range of motion: the active range of motion, passive range of motion, and the resisted range of motion. For the shoulder range of motion, you should learn all these movements so that you will be able to perform or show to your client the movements. The shoulder movements are flexion, extension, abduction, adduction, horizontal abduction, horizontal adduction, internal or medial rotation, external or lateral rotation. For the neck range of motion, you should learn all these movements so that you will be able to perform or show to your client the movements. The neck movements are flexion, extension, lateral flexion, rotation. For the elbow range of motion, you should learn all these movements so that you will be able to perform or show to your client the movements. The elbow movements are flexion, extension, pronation, supination. For the lumbar range of motion, you should learn all these movements so that you will be able to perform or show to your client the movements. The lumbar movements are flexion, extension, lateral flexion, rotation. The hip movements are for the elbow range of motion. You should learn all these movements so that you will be able to perform or show to your client the movements. The hip movements are flexion, extension, abduction, adduction, internal or medial rotation, external or lateral rotation. For the knee range of motion, you should learn all these movements so that you will be able to perform or show to your client the movements. The knee movements are plantar flexion, dorsiflexion, eversion, inversion, supination, pronation. For the ankle range of motion, you should learn all these movements so that you will be able to perform or show to your client the movements. The ankle movements are flexion, extension, internal or medial rotation, external or lateral rotation. This script may be helpful for the oral or practical examination. The first test I'm going to do is the active range of motion of your blank joint. State the joint area being tested. The purpose of this test is to check if there's any limitation in the movement of your blank joint. State the name of the joint. For example, the shoulder joint. I will show you how to do the movement, just copy what I do. You will be doing all the movements by yourself without my assistance. Do you understand everything? Do you have any questions? The first next test I'm going to do is the passive range of motion of your blank joint. State the joint area being tested. The purpose of this test is to check if there's any limitation in the movement of your blank joint. State the joint, for example, shoulder joint. I will be the one doing the movement for you without your assistance. Just fully relax your muscles. At the end of the range, I will apply overpressure to find the end feel. Do you understand everything? Do you have any questions? The next test I'm going to do is the resisted range of motion of your blank joint. State the joint area being tested. The purpose of this test is to assess for the strength and the ability of the muscles and other structures surrounding the joint to facilitate movement. I will be asking you to do the movement against my resistance and holding it for 5 seconds. Do you understand everything? Do you have any questions? Start asking the client to perform the RROM. Please bring your arm up towards the ceiling on abduction. For example, show the movement against my resistance and hold it for 5 seconds. Any pain or discomfort? Ask this question while doing the movement. Are you comfortable? Ask this question while doing the movement. And relax. Asking the client to relax after the movement. The strength of the muscle is, state the great example, 5/5. There's no weakness or shakiness while doing the movement. I'm going to do some orthopedic tests to help me come up with a clinical impression of your presenting condition. The first test I'm gonna do is, state the name of the test example, painful arc test. The purpose of this test is to assess for, state the purpose of the test. I would like you to blank, state the position, stand or sit on this chair or table or lie down on your back or on your abdomen on the table. I will stand in front of you, position of the therapist. Explain how you will perform the test. Are you comfortable? Asking for client's comfort. Any pain or discomfort? Asking the client from time to time while performing the test, it's client care. The result of this test is negative. No need to explain why negative. It should have been positive if you felt blank, state the positive result of the test. Guys, the following are the neurological tests in the assessment during the examination. The next test I'm going to do are some neurological tests, which include Dermatome, Myotome, Tinel sign, deep tendon reflex. Now, I will perform some neurological tests to assess your neurological responses. First, I will perform the dermatome test of your blank, state the area where you will be conducting the test. Is that okay with you? Dermatome test is to assess the normal skin sensation of a muscle or group of muscles that is supplied by a single nerve root from the spinal cord. I will be using a cotton ball to perform the test. Please let me know how you feel. Is it okay to touch you here? Show the area where you will be performing the test. Please close your eyes. It is important that the client's eyes are closed while performing this test. Perform the dermatome test by asking, "Do you feel this?" Asking this question while gently rubbing the cotton ball on the area first tested. Do you feel the same? Asking this question as you continue to rub each area with the cotton ball until all areas has been tested. Are you comfortable? For client comfort after doing the test. Once you are done performing the test, give the result. The test is negative. If the result of the test is negative, no need to explain a negative test result. Then, explain this, very important. It should have been positive if you felt numbness, tingling sensation while doing the test. If the result of the test is positive, then give the reason right away why it is positive. Positive test based on the client's presenting condition. This is the dermatome test. You can see here a diagram of all the affected areas involved in the dermatome test. We have the cervical vertebrae, thoracic vertebrae, lumbar vertebrae, and sacral vertebrae. Guys, the following information provided here are the sites of the cervical dermatome, thoracic dermatome, lumbar dermatome, and sacral dermatome. It is very important to know all these sites for your oral or practical examination. Guys, this is the script for the myotome test in the assessment during the examination. The myotome test. The next test I will perform is myotome test, which is to assess the strength of a muscle or group of muscles that is supplied by a single nerve root coming from the spinal cord. I'm gonna show you a specific movement, just follow what I do. Then I will apply resistance on your muscle. I will hold it for 5 seconds. This is to check for any weakness or shakiness on your muscle. Please blank, ask client to sit down or stand up or lie down. This is the client's position. Are you comfortable? Very important for client's comfort. Please do this movement. Show client the movement. Please make sure that the client does the movement properly. Is it okay to touch you here? Show client the area. Asking permission to touch the client. Then apply pressure on the muscle being tested. Hold it for 5 seconds. Check for any weakness or shakiness while doing this test. Any pain or discomfort. Ask this question while doing the test, very important. Are you comfortable? Very important to ask for client care. Now ask the client to relax. Are you okay? Very important to ask for client care. Then give the result of the test. The strength of your muscle is a grade of blank, example, 5/5, which is normal. There was no weakness or shakiness during the movement. Guys, the following information provided here are the sites of the cervical myotome, lumbar myotome, and sacroiliac myotome. It is very important to know all these sites for your oral or practical examination. Guys, this is the script for the Tinel sign test. Just say, please take a sit here on this table, or chair if available. Are you comfortable? Very important for client care. The next test I will do is Tinel sign of your blank, state the area of the nerve being tested. The purpose of this test is to assess for nerve compression, paresthesia, neuroma, or any neurological signs such as numbness, tingling, pins and needles, sharp, shooting pain. Do you understand everything? Do you have any questions? Giving the client the opportunity to ask questions/s. Guys, in performing the Tinel sign test, just say, I'm going to do a Tinel sign test on this area to test your blank, state the name of the nerve. Then, find the area. Is it okay to touch you here? Asking permission to touch the client to test the area. Then say, thank you. I will tap this area 2 times using my 2 fingers. Tap the area 2x and check for results. Any pain or discomfort? Always ask for any pain or discomfort. Are you comfortable? Very important client care. Then give the result after testing the area. If the result is negative, say, the result of this test is negative. No need to explain a negative test result. Just say this right away after a negative test result. It should have been positive for nerve compression if you felt numbness and tingling sensation on the area. Or it should have been positive for neuroma if you felt pain on the area due to abnormal tissue growth. And if the test result is positive, say this positive test result right away. The test is positive for nerve compression because you felt numbness and tingling sensation while tapping the area. Or the test result is positive for neuroma because you felt pain while tapping the area due to abnormal tissue growth. The information provided here are the sites or locations for the Tinel sign test. It is very important to know all these sites or locations for your oral or practical examination. Guys, this is the script for the deep tendon reflex test. Before starting your script, it's very important for client care to ask the client to sit on the table, massage table or a chair if available. Then as for comfort right away. Very important for client care. Are you comfortable in your position right now? Wait for the client to answer. Very important client care before you start the test. The next assessment I'm going to do is deep tendon reflex of your blank, name the tendon being tested. The purpose of this test is to check for the normal reflex sensation of the tendon of your blank, name the muscle. I will be using a reflex hammer to do the test. Position yourself in front of the client getting ready for the test. Is it okay to touch you here? Ask permission before you touch the area being tested. Then say, "Thank you." The reflex movement should be this blank, show the reflex movement you are looking for the test to the client. Please relax and close your eyes. Do the deep tendon reflex test, repeat once again if needed. Any pain or discomfort? Always ask for any pain or discomfort. Are you comfortable? Very important client care. The result of this test is blank, example, grade 2, which is normal. Guys, please note. You need to know the grading of the deep tendon reflex test to base your result. Guys, the following are the sites or locations useful for the common deep tendon reflex assessment. It is important to know all these sites for your oral or practical examination. The following information are the common deep tendon grading useful for your examination. It is important to know all these grading information for the common deep tendon reflex assessment for your oral or practical examination. Guys, this is a script for the pulse assessment during your oral practical examination. Today, I will be performing pulse assessment of your blank, state the part to be assessed. This test is to assess a response to a stimulus that occurs without conscious thought. Reflex testing is done by striking a slightly stretched tendon with a reflex hammer, then a simple muscle contraction occurs. I will be grading the response based on the result of the assessment with the use of the reflex grading. This test should be pain-free. I will be checking for your comfort from time to time during the assessment. If you feel any pain or discomfort, please let me know and I will stop immediately. Did you understand everything? Do you have any questions? Asking this question to give the client the opportunity to ask question or questions. Guys, this is a diagram with the information of the pulse points and pressure points useful for your oral or practical examination. It is important to know all of these sites or locations for your examination. Guys, the information provided here are the pulse rate grading and the normal pulse rate useful for your oral or practical examination. It is important to know these information for your examination. Guys, the information provided here are the pulse rate grading and the normal pulse rate useful for your oral or practical examination. It is important to know these information for your examination. Guys, please note. For client care during your oral or practical examination, it is very important to ask for client comfort before, during, and after every test your client performs in the practical examination. Before you start each test, ask for client's comfort, like for example, please have a seat or please stand up. Are you comfortable? During the performance of each test, ask for client's comfort, like for example, any pain or discomfort. Are you comfortable? After every test done by your client, ask for client's comfort before you give the result of the test. Say for example, please have a seat, if the client is standing or lying down on the massage table. How are you feeling? Are you comfortable? Then give the result of the test done. Guys, for your finishing statement, say, "So, we are done with all our assessments for today. Thank you for your time. I will be just outside the door to wash my hands. I will see you next for your assessment too."